you've been under chronic stress and just,
Yes.
I'm going to keep doing this and doing that and pushing through, and then reach a point where your body just says,
You've expended
no.
all the resources.
And it comes out for everybody, men too. You know,
Yeah.
I think everybody will reach a point where their body will say no. If hopefully we get to that before it reaches that point, because sometimes that shows up as disease or illness
Right.
or something. And so I try to, use the clues that I can get clinically to say, like, let's deal with this before the body really says no, or before like something really, does become more to the surface.
Welcome to the Vibrant Wellness Podcast. Today, we are thrilled to welcome Dr. Jennifer Knight to the show. Dr. Knight is a board-certified physician in internal and integrative medicine. She specializes in whole health, wellness, and longevity with a particular focus on helping women navigate midlife and beyond. A graduate of the Andrew Weil Center for Integrative Medicine and a certified menopause practitioner, Dr. Knight brings deep expertise in caring for women through perimenopause and menopause. We are so happy to have you on the show today. Thank you for joining us.
Thanks so much for having me. I'm so excited to be here.
Oh, well, I can't wait to learn more about what you do and kind of your story. So can we start out just by kind of learning more about your journey and how you got to practice the way that you're practicing now?
Oh, sure. I think it actually kind of informs what we're going to talk about. So it's an interesting journey. It started with heart rate variability, believe it or not.
No way.
Yeah. So I had just had my third child. It was back in 2019, and I bought this actual watch.
Is it a Garmin?
It's a Garmin.
Okay.
It's still kicking. So it's lasting.
Yeah.
But I bought it just purely to track my runs outside. It had a GPS. That's why I bought it.
Okay.
And I kept seeing this number, heart rate variability, and it was like really low. I mean, single digits. And I had no idea what that was at the time. And so, when you don't know what something is, you just like, I'm just going to ignore that.
Yeah.
So I ignored it for a while. And then eventually I was like, I should really, read about this. And when I read about heart rate variability, I learned that, it's been in multiple studies to increase, lower your heart rate, the lower your heart rate variability, the higher risk of all-cause mortality.
Right.
And it's a window into your nervous system and all this. And I started to wonder, I started to think about some of the reasons why mine might be so low. And then at the same time, I had started my integrative medicine fellowship. And the first module is appropriately entitled Clinician Wellbeing. So it's all about heal the healer,
Right.
and, that you have to heal yourself so you can take your patients on a healing journey.
Right.
So sort of all of this happened at the same time. And I went on my own sort of healing journey, learning about nervous system work and understanding why I had such a low heart rate variability. And throughout that journey, I just started taking steps towards what, felt more in line with like my purpose and meaning. And anyways, long story short, my life looks very different now. That ever since I completed the fellowship, I changed my job. I opened my own practice.
Yeah.
All of my relationships are different.
Wow.
My life is just completely different.
It's amazing.
Yeah.
Yeah. It's, I think it's really beautiful how integrative medicine just really does kind of look at the wholeness of a person. And I, did functional medicine training and certification, but I started in integrative medicine and I did the Andrew Weil program. And that really was like that really just beautiful, nourishing piece of my education that I don't know, it changed the way that like I also looked at my life and also how I looked at my patients and how could we help bring people to wholeness.
Yeah. And I think, I totally agree. I can say that, first of all, going on your own journey is really powerful. Then you can help guide others on that journey. And it really just starts with simple things, it doesn't have to be, you end up somewhere totally different, but it's really easy to get started. One of the things I love about integrative medicine, which is relevant to what we're going to talk about in a bit, is just the idea of recovery and the idea that the body really has an innate ability to heal itself given the right tools and environment.
That's
and
exactly
when
right.
I, thinking about that as a clinician, it's just so powerful.
Yeah. I think a lot of times our patients come to us, and even in medicine, we're not really taught about kind of how we can restore homeostasis. And I think we do have many more levers that we can pull than, most people really agree or think about.
Yeah, absolutely.
Yeah. When you see a patient, are you focusing first on nervous system or does someone come in the door, with like fatigue and brain fog and weight loss resistance. And then you're able to kind of like figure out that, at the genesis of many things, it's nervous system.
Yeah.
Are you saying that?
Yeah.
Yeah.
I mean, yes, I don't lead with it usually because patients don't come in seeking that. Typically, they don't come in like, I would like to regulate my nervous system, or, it's usually not what I lead with. I'll ask some basic questions. How do you feel about stress? How stressed are you? Tell me about you, your childhood, things like that in the initial consultation. But I really kind of wait to introduce a lot of that until I've established a relationship and we started working on things. Because what I found is like this work really comes into play a little bit further on. I think when you start any sort of a plan with a patient where they maybe nutrition, fitness, supplements, they're going to feel better initially. But what I found is this is what you really have to work on when that plateaus, and it usually does if you don't really look at like the nervous system and chronic stress and all of that, which is affecting your sleep and your weight and your all this stuff. So I usually will layer it in a little bit later on.
Yeah. Almost like do the low hanging fruit first, because those get your big wins quickly. And then you establish trust. You're feeling better. But then, when they stall, because inevitably I think that does happen.
It really does.
Yeah.
And I think then they're ready to take the next step. And also I think I used to, like, very early on I would lead with it and I would get a bunch of like, smiles and some nods and then some like outright resistance, like I'm not doing breathing exercises, like I'm not doing that. So I learned sort of like, okay, I need to wait on this one. This lever is not the one you pull right away.
Yeah. So initially, if you're dealing with micronutrients, are you doing hormone work as well? Are you seeing a lot of, because you're an MHT practitioner?
Yeah. So, I am certified. I'm a menopause certified practitioner. And I think that a lot of women come to me specifically for hormone treatment, which is great. I mean, hormones are having a moment, right?
They're very, very hot and very trendy and important,
and super important. It's long overdue, right? We
100%.
should have been talking about this for many years now,
at least 20 years.
yeah. And so I'm so glad that the conversations are happening, that there's people out there on social media, like people are talking about it. I think that's all very positive because it gets people through the door to see me. And hormones are incredibly important for women, right? For longevity and for just for feeling well and all of those things. But I found that what happens is my patients think hormones are the solution to everything because of some of the information that's out there. And that can be sort of disappointing for them to find out, like, yes, and you also have to do some of this other work. Hormones aren't going to take you all the way to where you want to go. But at least I'm just so grateful that it brings people through the door, and then we can start from there, and then we can take the journey.
Yeah, I think that the hormone piece is really important, and it's like a yes and piece because, like you said, just, replacing progesterone, estrogen, testosterone, that can help, but like, yes, and you still have to do all the foundational work. And yes, you still have to work on nervous system.
Yeah.
And then you always have to iterate.
Right. And I found, like, even particularly in earlier in early perimenopause, like the hormones don't get you the results as much as later you take estrogen, you're going to, the hot flashes are going to go away, and the brain fog is going to improve. But I found that in early perimenopause, oftentimes the hormones give you a little bit of reprieve, but the reality is that there's a lot of other factors at play in perimenopause. Your stress resilience goes down. So if you're, which a lot of people are, I would say most of my patients are living in an already state of like chronic stress and nervous sympathetic, dominance.
Totally.
Like they're living this way, right? Because they're in perimenopause. So maybe they have children, they have a career, they have aging parents. They have all of these things, and maybe they've been living in chronic stress since they were much younger, and their nervous system learned to be okay with that. Like they felt okay, and then the hormones start to fluctuate, and then all of a sudden, your resilience to stress is not the same as it was, and all of that stuff has to kind of be worked through. Because this is the time where it just has to be worked through, and so that's some people are not coming through the doors like, I'm ready to work through all this, and so it's a process.
Well, I almost think like maybe it's just a like cultural misconception just because of what's on social, but it's like you're gonna have to work, you're going to have to work, you're going to have to work for it. Like in your 40s and 50s and 60s and 70s, like it's not as easy as it was in your 20s and 30s.
Yeah. And it's different too. Like I tell my patients all the time that, what worked in your 20s and 30s is not, it's not the same. Like
No.
if things are different with the hormone fluctuations and the nervous and everything, and
the responsibilities
and the responsibilities.
Mm-hmm.
And, I think like there is some element of work that has to be done. I think about, I think it's Gabor Mate wrote a book that says like the body will say no if isn't that the name of the book? I think the name of the book is like the body says no. And I think the whole idea is like you reach a point where you've allowed, like if you've been under chronic stress and just, I'm going to keep doing this and doing that and pushing through and then reach a point where your body just says,
you've expended all the resources and your body's like, no.
And it comes out for everybody, men too. I think everybody will reach a point where their body will say no if, hopefully we get to that before it reaches that point, because sometimes that shows up as disease or illness or something. And so I try to, use the clues that I can get clinically to say like, let's deal with this before the body really says no, or before like something really, does become more to the surface,
I'd love to know like what kind of tools or data tracking you're using to support nervous system regulation.
Yeah. That's a great question. So I think, well, first, when I talk about data, the objective data is what really gets me to get patients to buy in.
Oh, yes.
Right. So I love that. It's super helpful. So that's the tool. That's how I will get the conversation started.
Yeah.
And especially for my high achievers, then they're like, oh, like my heart rate variability is low. Like I need to, I'm going to like achieve my life, So, I'll look at wearable data is super helpful if patients have it, and I'll encourage them to do it at least temporarily so we can get some data.
And do you like your Garmin versus Oura, or do you have a favorite?
I probably like the Oura best. Yeah. So I mean, I have both on, as you see, but if I were to choose, I'd probably choose the Oura, and because I like it's easier to get the sleep data.
I want that readiness score really high.
Yeah. And I think and wearables aren't for everybody. Some people really obsess a little too much over the data, and then now that's stressful. So you have to be careful with that. But I think I love, resting heart rate variability, sleep scores, readiness scores, but also CGMs are great.
I love CGMs.
So I love looking at the continuous glucose monitoring. And even if I don't have any of that, I can still find something in the labs.
Oh, yeah.
I'll find a cortisol, or I'll find an inflammatory marker, and I'll be like, this is, or insulin resistance, and we can start the conversation about stress and nervous system work through that. So usually it's a combination of that, and I'll be able to get the patient engaged. Yeah.
So where do you see the intersection of like, insulin resistance, metabolic syndrome, and nervous system kind of dysfunction?
Well, I mean, I think it shows up in your ability to do all the things that, like, as far as insulin resistance, right? One of the pillars of insulin, right? There's strength training, of course, your nutrition, of course, but you still, sleep is incredibly important. And if you have an activated nervous system that doesn't know how to deactivate because it's been chronically activated, and that's, if you think about it, if you've been under chronic stress and haven't given your nervous system or your body the appropriate rest, then your nervous system has adapted to that.
That's true.
It's actually, adaptive and a survival thing, but you're not going to sleep well, right? And if you don't sleep well, that'll affect your insulin, resistance. And so I think that's sort of how I use it. Yeah.
Yeah, I think that's interesting, because I think also probably a lot of the, women that we take care of in their 40s, they might have had kids like in their mid 30s or late 30s. And so then you also, or maybe even in their 40s, right? Especially if we're talking about high achieving women.
Yep.
And then, you've got like a 43-year-old with a 4-year-old that still wakes up, several times through the night, and they're going through perimenopause. It's just hard.
Is this sounding familiar? No.
Yeah. I'm like,
is that me? You're talking about me? Yeah. No, it's hard. And I think like figuring out how to navigate with those, I think that's what's so incredible about stress work. Like I think, your body is designed to handle stress, right? Like it's not designed to have no stress. And the whole idea is then how do you balance that? Yeah. Right. Like, and you mentioned homeostasis earlier. And I think about that in terms of like homeostasis is you have to have your there's a certain like bit guardrails. You have to have your temperature a certain way, your pH a certain way, or that's like your body has to do that, right?
Yeah.
And then there's allostasis, which is like your body's ability to adapt with change.
Yes.
Right. So your blood pressure is allowed to go up when you exercise or when you're about to do a podcast or something. Right. But the whole idea is then it's supposed to go back down. But if it never gets to go back down, now you have this allostatic load that is, it leads to lots of problems.
Yeah, definitely. And okay, so when you're working with patients and you're doing nervous system work, is part of that work, like it sounds like part of that work is helping them to sleep better.
Mm-hmm.
And so how do you approach that? You probably with some women, you might give them progesterone because that often helps. But then is it like exercises before bed, like diaphragmatic breathing? Or are you doing vagal nerve stuff? Or are you maybe like supporting GABA pathways? There's just there's a lot of different tricks and levers, but I'm always trying to collect more pearls for my own person.
Absolutely.
So tell me all the things.
Yeah,
what do you do?
I mean, a lot of different things. I think that sleep is so incredible, so foundational. It's like one of the most foundational health tools. First, they have to buy in that sleep's important.
Right.
I have, that you have to get 7, barring the children in things that you can't control. But, I love magnesium. That's great. Glycine works well for some women.
Yeah.
And definitely like a nighttime sort of ritual. And I think it sounds so simple, right? Like, and everyone's just kind of like, it's not really going to help. Like, it's not going to help, but it will. It does. It really does. Like if you do all the things, right? And I think, that's where I think sort of the mindfulness comes in. And I'll say, you have to have time for, like, I think it's called white space, right?
Yeah,
where you have time.
I love that.
You make time during the day, and even if that's at night, instead of what we all do, we all say we don't have time, but we all know that we do some stuff. We're scrolling at night, right?
It's that vegetative kind of like just not thinking about anything hard. But I like that white space. That's a really good way to say it.
Yeah. And just like make time for it. And then at the end of the day, just instead of, I'll tell you, like sometimes it's like, well, I still have all this stuff on my to-do list. And so I'll say like, just make up like kind of like a parking lot list, which is like, these are like, it kind of lets your brain, it's a way for you to tell your brain like, okay, I recognize that I didn't finish this and I still have to do this. I'm going to quickly write it down and then I'm going to put it away.
Yeah.
And then I'm going to either, think about 3 things I'm grateful for or ways that I could, spend more time with my children or whatever, like something more meaningful, and then some breath work in bed.
Yeah. I love that.
Yeah.
Yeah.
But magnesium and glycine, I think like that along with some supplements is super helpful. Yeah.
Yeah. I've had a lot of success with glycine and magnesium, like you said. And I don't know, I really like a product by Zymogen called Relax Max.
Oh, I haven't used that one.
Yeah, it has like a little bit of GABA and a little L-theanine and a couple of other great things. I think it has inositol, so it's a nice little it's a nice little cocktail. But I think that solving sleep issues is one of the biggest things for patients, and it's tricky. I mean, I've had patients also sometimes use PEMF mats that can help just make them feel really relaxed before bed, but it's so bio-individual.
Right.
And then of course, like circadian rhythm. And so if they can,
the morning affects the night.
Right. And so if you don't, most people will have a hard time getting up and going outside, honestly, and looking at the sun. I know that we say like, go outside and get 10 minutes of sunlight, but it's like, when you've got 3 kids, you got to get to school on time, you got to make them breakfast, and you got to get to work on time. It's really hard to make time for those 10 minutes.
That,
like, how do you do that?
Yeah. Yeah.
So I don't know. Maybe I think that there's some Lux lights that you can get. Some people will do.
I have one of those actually. And I I'm pretty consistent with it.
Does it help? Do you use it like while you get ready in the morning, or how do you do it?
I'll try. So you have to be, but you have to you're pretty close to it. So you can't like be making eggs or anything. So, it's a bit hard to operationalize in some mornings. It's just not going to happen. But, when I can do the 10 minutes or so, I do it. Cause I live in New Jersey and it's dark.
Yeah.
The winters
are
dark.
It's a long winter.
It can be a little gloomy. So I try to use it as much as possible, but it is a little challenging to operationalize. But if you do get up and, or you are checking your emails, you can actually do it at the same time. Like so
that's cool.
Yeah. I
I think I saw something recently that's like these little glasses that you can wear even. Have you seen those?
No.
I feel like, is it a gimmick or should I get it?
I feel like it's maybe,
I don't know. Maybe I should get it and try it.
Yeah. I don't know.
Yeah. Do you use vagal nerve stimulators at all?
So, right. So the tools.
Tell
like,
me
how
about
do
all the
we-
tools.
Yeah. I mean, so yes, I think.
Because I think breathing, obviously diaphragmatic breathing, is going to be the best tool that you can use. But a lot of people don't have the patience for that.
I know.
And it's like, I will not sit for 10 minutes and do deep belly breathing. I can't
know.
focus. And I get that. So then what do you do?
Right. So, I mean, this is where it really is individualized. And I think for someone who just it really won't even like explore those options, then vagal nerve stimulators are a wonderful option. And I think I've had patients, love them.
Yeah.
But I do try to I still think the breathing is important. And so, it's hard for me to accept that like, the breathing's like off the table, it's like really hard for me. But, and I try to tell people to just start with little things like habit stacking. So
I love habit stacking.
Habit stacking is
work smarter, not harder.
A life hack. Yeah. Like, and for me, it's how I get it done. So we have a joke in my family when we sit down to the dinner table, like I'll often tell everyone just to like relax their shoulders and like they make a big joke and they all kind of like slump over. But we're now going to like relax and like enjoy like our time together and actually like be present. And so for me, that's like, and so like, and sometimes when I'm doing things I just have to do anyways, like driving to work or doing dishes or whatever, I'll do the breathing then.
Yeah. I love that.
And I'm like, cause I'm stuck doing this anyway. So I could be washing my dishes with everything clenched or whatever, or I could just be breathing and like that, so I tell people there's time you don't have to necessarily like
carve
time.
out 20 minutes and sit on a cushion in the corner.
Right. You're folding laundry.
Right.
Breathe.
Yeah.
I
love that.
And so that's been, I think I've been able to get through. And then it's really interesting when you start doing those sorts of things throughout the day, you develop this sort of connection to it. And then you'll notice, like I remember I was on the plane yesterday and I was like, oh man, like I need to breathe, like you just kind of like get this body awareness and then it promotes you doing it more and more.
Yeah.
So I just try to get them to start doing something.
That's good. I love that.
Yeah.
Yeah. I think even 3 minutes.
Yeah.
And, back in the day, well, I still use it a lot. But before there were all these other tools, I would always recommend the Heart Math Inner Balance product for patients.
Yep.
Because I would be like, it's 3-minute cycles. You can literally go to the bathroom and do that for 3 minutes.
Yeah.
If you're having a hard day at work or whatever, if you're feeling anxious or if you need to just clear your mind.
No, and that it's been a while since I used it, but it does give you the objective data too.
It does.
It'll give you the feedback.
It's biofeedback, so it's telling you like you are incoherent or you are not, which can be a little stressful if you're not and you're like a high achiever.
How do I get there?
I'm like, I'm failing.
Yeah. No, I think the biofeedback makes a lot of sense. And then I think just having, for me, I think part of my journey, which I alluded to earlier, was like the idea of taking just steps. And I try to get people to connect with their values and their life and how they're living their life because it often starts with like something like for me as a doctor, I always felt like as a mom and a doctor I was being pulled and like it was like a tug of war, right? And I would almost, sad to say it, like saw parenting as like a stressor, like you don't get a teaching award or accolades for like being a troop leader, so I was always like, where should I be putting my energy in? Like I wasn't actually like aware that I wasn't putting my energy in the right places because I was just being pulled so hard in one direction. Yeah. And it was almost like you're being like pulled with a current and I had to like put my feet on the ground. And I was like, but being a parent, whatever it is that's really important to you, just making sure that you're living that life. And so there's an exercise that you can do. I think it is Martha Beck. No, I know it's Martha Beck, where it's like, imagine your perfect day. Do you know about this? It's kind of like a mindfulness exercise. So you just, you can look up online.
Walk us through it. Yeah.
But you just, obviously you ground yourself, you take and you do this like visualization of you could have a perfect day. What would you do from wake up to go to sleep? Like what would that day look like? And really, it's incredibly grounding because it's like, does that match how I spend most of my days? Yeah. And if not, then how do you take at least a baby step towards that day? Yeah. Is it mean saying no to something and then wait, I don't know how to say no. Now you have to do that work. Right. And then so fine. Then now you learn how to set boundaries. And then what's the next what's the next journey you're on? Yeah. And like that's why I said that's what I went on. It took me years and now I have a completely different life, completely different marriage, completely different parent. Like but it just was one little step at a time. It
takes that first step. Yeah. And then that will, lead you to the next step and to the next.
Yes.
And then I feel like the path kind of reveals itself.
It does.
Yeah.
It really does. And it's hard to, and so I think, it's hard to say like, I would have never said like, I'm going to do this and then I'm going to end up, leaving my, like in this, but I think I just tell patients like you just start walking.
Yeah. I
that
love
way.
that.
You know,
Yeah.
and you'll figure it out.
Yeah.
You just have to make the space to figure it out, you know?
Yeah. I think that's where it gets tricky, because a lot of times people are willing sometimes to change for health, but then like infrastructure of life and like these bigger questions, that can be uncomfortable. Yeah. And scary.
Yeah. No,
especially if you're patterned in doing something a very particular way, then, you know, you have to relearn. But, you know, our brains are plastic, so we can.
That's the beautiful thing.
Yeah.
And your nervous system is too, right? So just
Yeah.
because, you know, maybe you learned early on, you know, in life or later in life that, you know, like you learned a stress pattern, your nervous system was stressed for whatever reason. Just because it's been like that for 40, 50 years doesn't mean it can't relearn and you can't adapt.
I think that something that I probably have learned in my 40s, even though I knew it, but I really kind of I've learned it more and I'm really owning it, is that the body is adaptable. You know, like I think it's easy to think that our bodies are broken, but I think that we live in a very adaptable organism, right? And so that gives people a lot of hope. It gives me a lot of hope. So, you know, maybe I can teach my body to do something in a different way.
Absolutely. And oftentimes when you see things that like are broken, maybe that was your body adapting the way, you know, to survive that or whatever it is, you know, and you think about how the nervous system when you're younger, if you're going through, you know, obviously, you know, childhood traumas are incredibly common, right? I think, you know, 60% of people have at least one ACE score, you know, so, you know, but your body adapted, your nervous system adapted in a way that helped you survive those situations. And so, you know, you have to honor that. And then also recognize that maybe it, you know, it doesn't have to stay that way forever, you know?
So your body did the best it could with the resources it had.
Yep. And I think a lot of times that's what's happening, right? Like if you have not slept and this and that, whatever, you know, like all of these things that are kind of going haywire, that's your body adapting to its environment.
What do you say for like the women who come in and are doing all the things? Like you've probably seen like the memes on social where like a woman's wearing a red light mask and she's standing on a vibrating plate and she's got like her clean water bottle and she's got her weighted vest on and she's doing all the things. Yeah. And like she's doing all the things and she's so exhausted and tired.
Yeah. Usually that's what it is. Yeah. Right. Like, and I think especially there's such an idea that I just need to work harder to get the results. I need to push harder. I need to push my body harder.
Add more.
Yeah. And I think I see this a lot in my women, you know, that come in around the perimenopause, menopause. They're trying to push harder. And actually it's hard to grasp, but they actually need to push less hard. Yeah. You know, and sometimes they need to eat more, you know, and it's like, it's a hard concept to get through. But when that's where data is helpful. Yeah. That's where data is helpful.
Because I think if you're used to just like, you know, white knuckling it and just like doing it and doing the hard work, like why wouldn't it work now?
Yeah. And it's okay. So I'm doing it harder. I'm waking up at 4 a.m. Yeah. And like, you know, I'm doing it even harder, you know, and I see that all the time. And I'm like, oh my gosh, you need to sleep. Like, don't get up at 4 a.m. You know, so oftentimes it's a conversation of this is a time to actually like really take care of your body, not push it to extremes. And because people are getting injured, you know, I mean, it's a lot. And that's what the body's saying no, right? So yeah, that's typically what I find. And then the results actually happen. Yeah. You know, not necessarily, you know, sometimes it takes a little bit of recalibrating once you start fueling and nurturing your body. Right. But the results will happen. Yeah. They will.
It's definitely a relearning.
Yes.
Yeah. Yeah. I mean, if I could prescribe sabbaticals to my patients, I would. I try when I can.
You do?
Yeah.
Like what you just
like sometimes I'll write it. I'll say like
I love it.
You know, sometimes people will be in between jobs. They'll be like, they can take some time off. I'm like, do it. Take a month off. Take 3 months off. Do it.
Well, and that's uncomfortable sometimes, right? If you because I think, you know, we live in a society that's very you're rewarded for producing something, right? Or right, and the idea, and if you've been living in this chronic sympathetic state for years and years and years, it feels uncomfortable and against your identity to some point.
That's a good point.
Because your identity is this, whatever it is, successful,
productive person,
blah, blah, blah. Right. And so it's like, it threatens your identity. And also like your nervous system is not it's going to be like, this is not where I feel comfortable. I'm supposed to be stressed, where's the stress? Like, what am I doing?
Yeah.
So that's awesome. So what have been the results?
Amazing.
That? Yeah.
Yeah. They all get better.
Yeah.
I think about like, do you remember like reading in like old classics, like when I was, when we were kids, like people would prescribe their patients to go get mountain air or sea air whenever they were sick. Yeah. Like, do you remember that like in Heidi or in like some of those books?
Yeah.
Like you would just tell someone to go, they would just tell you to go to the seaside for like a summer.
Right.
Or go up to the mountains for a summer and then they all get better.
Yeah, we've lost track of that. I know. And I think when you look at even just light therapy, right, is having a moment now. And like light therapy has been around forever.
Amazing.
You know, I mean, we used to, sunlight was, there was, what are they, solarium?
Spanish flu, isn't that what they put everyone outside in the sun?
You just go, right. I mean, and, we totally lost sight of the value of that. We have all these, blue lights that are, that are not good for us. And so, we've kind of lost track of some of those like foundational healing techniques.
Yeah. Mm-hmm. So, a lot of our audience are clinicians and, some are seasoned clinicians in the space of integrative and functional medicine, longevity medicine, but some are just learning. So what would you tell someone who is, really wanting to maybe break out of their, normal clinic schedule where they're seeing 30, 35 patients a day and they are just having this yearning to do something different, but it feels scary and overwhelming and they don't even know how to take the first step? What would you say?
I would say just start taking steps, right? Because I think, whatever that might look like.
Right.
So for me, it was, I just started doing my training while I was doing while I was working, my and it just gradually, like, it just was like one decision at a time, one small step at a time, would be my best advice. If I don't know if there's like a,
I don't think there's a right answer, but I think like, maybe just take a course or, even find a mentor, or talk to someone that's doing it, because I think that most of us in this space, like I'm always happy to tell people like, like think about it, or this is how I did it. Mm-hmm. Don't be reluctant to like ask for help or ask someone that's done it also. Right.
And there's lots of different ways to do it.
Yeah, there's so many ways.
Yeah, you could, you could start a smaller practice. Like you could start small. You could do things.
You could do locums and start something. You could add it. Yeah, you could just add it to your traditional. Start working on things with your patients, and then you're going to reap the fruit of that. And then after that, maybe you'll have more confidence to like then change your practice a little bit if you have the capacity to do that, or maybe then it's a time to like step out on your own. Right.
And I have a friend who's a integrative pediatrician. He has a model where, he started off doing just, general pediatrics, and then he added the integrative component. And so he charges, a fee, I think, per year to just be able to spend the time to do it. But it's a very reasonable fee. Yeah. And so he still does the general pediatrics with this as an added layer. And I think that's a nice balance. Yeah. And then eventually maybe you decide you want to do fully integrative or whatever, but there are ways to kind of ease in. Yeah. Yeah, but the first step is being curious and learning, and I would say most importantly, definitely like look at yourself, right? Because I found that like if I don't know how to do any of this stuff, or I'm not doing the things myself, then
can you ask someone else to do it?
Yeah, like it's not going to land.
Yeah, I agree with that for sure. Do you have any like exciting outlooks for things coming down the pipeline in medicine? Or do you just feel like we already have most of what we need and we just need to implement that? Like what excites you? And then also what do you think we kind of need to cling to as well?
I love the idea of, using AI a little bit more to really use this data that we have on patients in a way that's more, I don't know if efficient is the word, but just more powerfully and track it better. I sit down with some of these, it takes, I'll sit there for hours looking through people's results, and my human brain does the best that my human brain can do. But, I think there's power out there. So I'm excited about that.
Absolutely.
I am excited about peptides. We do those in our practice, and we've had some really, really, really exciting results with peptides.
Do you have any favorite ones right now?
In addition to all the other stuff.
Yeah.
So like everything else, peptides are a tool that
Yeah.
I like to think of peptides as a way that we help get the wins, like you and I were talking about initially, while we work on the other stuff, because you don't, you can't stay on peptides forever.
Yeah.
Yeah. So we do a lot. We do we have lots of different ones.
Yeah.
But we do the typical ones, the thymosin alpha, and the BPC, and all
those
of
your
that
favorite
stuff.
needle movers?
Yeah. I mean, GLP-1s are obviously a great tool in the right person and with the right supervision. They can be game changing. So, I mean, but we use a lot of them, and they're really exciting. Yeah. We've had some great, so that's exciting. And NAD, I forgot NAD. I mean, all this stuff I think is like on the horizon. And I think, medicine's going to change. I'm also excited about psychedelics.
Oh yeah.
I think the whole field of, psychiatry might really shift. And I think we should all welcome that. There's such great data on it. And so I love that some states are already really kind of paving the way for that.
Yeah.
I hope my state one day, will follow. So I'm really excited about those too.
Yeah.
Yeah. Like in New Jersey, I don't know the state laws everywhere. Maybe you do, but I do ketamine, which can be very,
very transformative.
Yeah. Yeah. But, it'd be great to have access to psilocybin and things like that.
Yeah. Well, and there's powerful studies coming out of like Duke and some big institutions. Yeah.
Yeah. No, I mean, the results speak for themselves. I mean, it's incredible.
And in military too, I think.
Yep. Yeah. I think there's a lot going on. And I know there's studies, in end of life, the whole, and how powerful the experiences can be to, for the existential dread, and the whole, idea of that is, I think, really kind of beautiful. And so I hope it's available for more people soon.
Wow. I had not learned about that. That's amazing.
Yeah. Like the whole idea of having that sort of spiritual experience, like as you're transitioning, like think, how incredible is that to give to people? And I think it's, there's studies, like there's clinical trials going on right now looking at that in the palliative care world.
In hospice. Okay. That's interesting.
And it's very, very, powerful and positive results. Yeah.
Wow. That's cool.
Yeah.
I think I'm also really excited about AI. I love the convergence of being able to put data in, ask questions, pull up every study from like the whole world, and then, just have that information at my fingertips. I feel like that's been really useful. I appreciate that so much. It's like having a PhD assistant, at my beck and call. That's been nice. I'm excited about peptides too. I'm excited that like the FDA is going to allow more peptides to be used again. I think that just happened this weekend. So, and I'm really excited to see what we can do to really help optimize longevity. But I am also kind of such an old school kind of gal that sometimes I wonder if don't we not already have some of these answers? Like.
I totally agree, and I think that the idea of longevity being about preventing illness is such a missed opportunity. Longevity is about life, right? It's about living,
right? And
that's not the absence of disease or whatever. That's having joy and connection and living a life full of purpose and in line with your values and all those things, right? And so I think like we get lost in the yes, I want your ApoB to be that goal, and yes, I want all these things, and those things do matter, right? But we can't get too caught up in optimizing and forget about like the living of life. Yeah. And so I think for me, that's like my thing. Like longevity is about life.
Yeah.
Yeah.
Enjoy your life.
Yes.
Better to enjoy your life and maybe not do the healthiest thing than to like live this super duper healthy life and then like be all sour and sad about everything.
Right. Yeah. The whole idea of like, why would you then want to live to be 175 if like all you do all day is like
think about
cold
your health.
plunge and then red light and then Norwegian 4x4s and.
But I think that is appealing to a lot of people right now.
Yeah, and I think that's. I really do believe it's not an either or. It's both. Like most things in life, right? It's like both are true, right? Like they're both important, and you just have to figure out how to balance it. Yeah, and what's right for you.
Yeah, and I think the world is just so weird because. We're 24/7 connected and we're always getting notifications, and then we're always, hearing about all the bad news everywhere and not really any good news. And so everything seems like like a true threat, right? So how do you not live in sympathetic dominant mode?
It's so true. And I think, I mean, your body doesn't know the difference between
Yeah.
what you're watching on the news and like
Reality.
what
Like,
is it in your
it
house
could be a
or
predator
not?
in your home. Yeah.
Right. Like so it is really important, I think, and I'm sure it's been like this, you know, I mean, our parents could probably say the same thing.
That's true.
You know, so it's kind of like the idea that stress is always there, but it certainly feels heightened, at least for me. And
But
so,
I think when our parents were, you know, our age, they had newspapers and they had like news broadcasts like once a day.
Yeah.
And we're just getting like all of it shoved down our throats all day long.
Yeah. Well, and I think that's our choice.
That's true.
I feel like I tell patients all the time,
Yeah.
like you have to, of course you want to be informed.
Yeah.
And then there's a limit.
Yeah.
You know?
Yeah. I recently just started using the brick on my phone. Do you ever use that or have you heard of it?
No.
It's like this little device. I don't know how it works, but you download the app and then you swipe it with your phone and you can block everything that you want to block. Like you can choose. So you can block social, you can block specific websites. Like if you're always checking the news. So it kind of helps you repattern. Like even if you go to check it, you can't do it. So you don't get that dopamine hit.
It's probably good for kids, right?
Yeah,
for teenagers.
Totally. Yeah, I know. I told my son today, I was like, I'm going to brick your phone.
I'm going to brick your phone. I love that. It's going to be like a new expression that goes around. Like, my mom bricked my phone.
Yeah. Probably. Yeah, I think you're right. I think we often forget that we have a choice.
Yes. I think, and that was me for so long,
Yeah.
right? I was like, this is just my life, you know? It's like, no, you know? I mean, of course, there are things that you don't have a choice, you know?
Yeah,
like
there's some things that you absolutely can't, you don't have a choice about. But you can choose how many times you check the news. You can choose the news, how many times you go on social. Like, those are things that you can choose.
Yep.
Like, there's those circles of control, right? And so, you know, there's many things you can't control, but there are some things you can control.
Yep.
And if you can control your peace, I think it does make a difference.
Yep. I haven't read this book in a long time, but there's a book called Happiness. I think it's a pretty popular book. I think it's a course at Harvard.
Oh, cool.
One of the things you do is just really like analyze your time and like how much time am I spending on things that drain me? How much time am I spending on things that you know, make me feel good and are in line with what, and like you kind of do like a real assessment of like, but how much of this is absolutely necessary, and then how much of my time am I wasting on things that I, you know, and just like
That's
doing
so
that
interesting.
doing that whole exercise, because I think if you do get caught in ruts and then you feel like you don't have a lot of leeway, because there are things that you have that you don't want to do that you have to do. Totally. Right.
I had that conversation with my son this morning. Like there are a lot of things that you're just going to have to do, even though it's not fun, but there are a lot of things that you can choose.
And that's where you focus your energy, right? If you focus your energy all day, you know, you get to choose what you spend your energy on. So if you want to spend your energy upset of the things that you have to do that you can't control, like you could do that all day. Or, you know, you could try to focus on the time that you do have and like making that as valuable as possible. And I think that's where the true, like, that's where you get to really have power. Yeah. You know, in the other situation you have, what are you going to do about that? You know?
Oh my goodness. Well, this was such a wonderful conversation. I am so glad that you came on the show today.
Oh, yeah. Thank you so much for having me.
Lots of awesome pearls and a lot of wisdom. So can you let us know where we can find you, where patients can, or, you know, clinicians or patients, anyone watching can find you on social media, can find your practice, can learn more about you and your work?
Yeah, sure. So our practice is called Nova Wellness. We're in New Jersey. So our website is novawellnessnj.com. And so Nova has social media, and also my personal social media the handle is Jen Knight MD. So JENN KNIGHT.
Awesome. Well, thanks so much.
Oh, thank you.
Yeah. Whether you're a practitioner looking to bring more clarity to your protocols or someone on your own wellness journey who wants better answers, Vibrant Wellness is here to support smarter and more personalized care. Visit vibrant-wellness.com, follow us on Instagram at Vibrant Wellness, and be sure to like and subscribe to the Vibrant Wellness podcast for more conversations with leading voices in health, longevity, and personalized medicine.